Munoz again. Today, I'm going to share with you my latest experience at the Society of Hospitalist Medicine yearly conference. And this happened just not too long ago, 2 weeks ago. And it is a conference especially for hospitalists. Um, Primary care doctors can come, family practice, internal medicine, outpatient doctors, nurse practitioners, physician assistants can come here because there's a lot of topics that provide a good update for practice. But it is intended to be a meeting for hospitalists. Now, as we know, primary care doctors such as family medicine, doctors can be hospitalists, and this conference gathers program directors, hospitalists, outpatient doctors, entrepreneurs, doctors, anyone that wants to come here, medical students from anywhere. Actually, we went to see a couple of international doctors that came here. So, what I want to share with you is the content of this conference, not the message of each of the classes, but for the IMG, what is important is to know that these the selection of topics given or discussed during this conference comes from a need of more information or a focus on this area for the benefit of the hospitalist practice. So for the first day, for Monday, the topics that were the most interesting, the ones that gathered the most people were on day one, lower or liver inpatient management of the compensated cirrhosis. And some updates were given during that class, the management of spontaneous bacterial peritonitis, the management of transfusions to reverse INR, or how to use INR before procedures, how to treat a patient that has a severely elevated INR and we're getting this this hard time from radiology who doesn't want to perform a paracentesis just because the INR is outside the limits, or there's a concern for active bleeding and how to start treatment for suspected bleeding esophageal varices. The second topic that what gathers the most attention on the first day was management of sepsis, and we were looking at seeing if there was any changes on the protocols to identify sepsis. Um, it came back to the decision that it was back to SIRS and maybe a little bit of a use of QSOFA, but QSOFA hasn't taken the main focus as it was supposed to. Actually, the thinking has gone back to SIRS being predominantly the tool to use to identify sepsis early and with the most benefits for outcomes. The next topic that was very interesting was acute coronary syndromes, and you can see in between those big topics there were some other topics that also were part of a very precise selection from the organizing committee. Um, Stroke management, important for the hospitalist. And lastly, on that same day, it's insight on perioperative management. So what can you get from this information? First is that hospitalists or internal medicine doctors, family practice doctors that follow this path, they don't do it with all the knowledge. They need to incorporate knowledge from other specialties to their practice. So for you, for the IMG applying to internal medicine, family practice, pediatrics, neurology, one of my message with this is don't focus just on getting an inpatient internal medicine rotation, because all that you put on your CV, on your resume at the time of application will add to your experiences, will be your portfolio. So if you come with a rotation on infectious disease, a rotation on cardiology, a rotation on hepatology, or a rotation on neurology, or even on anesthesia, all that your experiences there and how you gather information, how you discuss that information during your interview, it was going to make a difference. For example, let's say you chose a rotation on anesthesia just because it was the only thing that was available. So I'm telling you that there is a focus on the management, the perioperative management of a patient, and how this falls on the hospitalist shoulder, the internal medicine doctor, the resident that is managing this patient perioperatively. Or you are doing a rotation with neurology. How important is for a hospitalist to have a very good foundation on identification of stroke syndromes? Or or you were doing a rotation with infectious disease, and now you're bringing all this information. How important is to not to rely on QSOFA only, but to do a combination of CIRS and QSOFA for a better identification of these patients at risk to develop sepsis. You could also discuss the proper management of patients with cirrhosis, and this is what's going to open the the other sessions that we're going to discuss. Is that there was a huge interest on management of patients that had drug abuse history, and what are the options, and how hospitals become now the the main players on treatment or providing treatment to these patients. So more of that on the next video.